All right, we're going to cover some trunk exercises. These are exercises that we can teach our patients literally for their home exercise program. They're not difficult. They don't require a lot of comprehension, but we do want to educate them on the rationale for them. So they're not very complex movements. Essentially, what we're doing is educating the patients on some trunk and upper extremity movements, either to get combined or separate, in order to promote expansion of certain segments or certain areas in the chest wall that might be restricted post-surgery because of chronic disuse, anything of the like, even rib fractures, for example, right? And we can also use these exercises in the opposite manner to promote airflow out of the lungs so that they can fill them up a little bit more. So the first one we'll cover is butterfly, or what's called the butterfly exercise. So essentially, we're going to teach them how to breathe in this segmental pattern, or pace pattern, I should say, with the upper extremity, with the use of their trunk and their upper extremities. So I want you just to go ahead and relax. Good, and kind of breathe normally. My preference would be to be in front of the patient right now, but I don't want to get in front of the camera and show them what I want them to do by doing it myself. But essentially, don't go yet when I tell you to do so. When you breathe in, if you watch my arm, I want you to kind of raise your arms up as high as you can when you breathe in, and when you breathe out, bring them all the way down kind of as far as you can. Of course, don't fall forward. I'll hold on to you and to kind of get some of that air out, okay? So go ahead, and it's going to be with both arms. Good, up. Breathe in big, and then exhale. Good. Good. At your own pace. Good. What this is doing is this would promote rib mobility, or expansion of the rib cage during the lifting of the upper extremities. It would promote expansion of the lungs. It would also assist with some of the movement out of the lungs if they were retaining any volume in the lungs as well when she comes down.
The other way of also seeing this done is to have the patient place their arms behind their head, slouch down, come up, and when they slouch down, come back in. What we're trying to do is we're trying to open up this upper chest to decrease some rigidity in the upper chest. We can also just have them focus on the exhalation phase. So we can have them start up here with inhaling without movement, because we may want them to get more lower chest expansion. And then we can have them come down. And this is really helpful in your patients with COPD, because a lot of times they have trouble getting air out. So they have airway trapping. And so helping them work on this expansion of the lower chest, since everything in their chest wall tends to get pretty rigid because the angles of the ribs change. We can have them use this as a way to help them start to get some airflow into the lungs and out of the lungs.
Absolutely. These are great modifications to exercises. Always think about how we can modify, like a patient position in ortho, right? We're going to modify it because of pain. We're going to modify the position. Trunk rotation is also another great exercise that we can utilize both to promote inspiration or promote movement out of the lungs as well. So for example, let's concentrate on her left side, on her left rib cage. We've already assessed, we know that she's not breathing in properly, we've auscultated, and we've done all of our assessment measures or evaluative measures, right? When I tell you to do so, don't go yet. I'm going to have you, when you breathe in, and don't move yet, I'm going to have you turn that way, okay?
Mm-hmm.
And then when you breathe out, you're going to return and you're going to turn to the left, so kind of opposite directions. Does that make sense? Mm-hmm. And breathe as big as you can, okay? So breathe in, good, and breathe out. Now, what this is doing is we're promoting mobility of this left side by having her breathe in, if we're concentrating on just mobility of that left side. We're expanding this side and we're compressing on the right. Let's say that she has decent posture, she doesn't have any segments that are impaired, and we want to get some air out of this left side, and then we can switch to the right side. We can do something similar. So we can have her rotate. So take a deep breath in, and then when you come down, I want you to kind of come down and squeeze right there. Good. And all the way down, right? So this is a way to promote airflow out of that right lung, and then we switch it, and we do it on the other side. Good. And then come down, good, into my hand. There you go. And out. Is another way to modify the therapist pushing on the rib cage. It's a self-exercise they can perform. And it's not only going to help mobilize, it's going to help them activate some of those muscles, some of those respiratory muscles that we talked about, right?
So what also too, this is a great exercise with people that have musculoskeletal restriction in their trunk. and that people with thoracic spine pain. So a lot of times we know in patients with thoracic spine pain, their trunk doesn't move real well into rotation. Those segments are not working really well. So using breathing to assist that trunk mobility can sometimes be helpful. This can also be helpful in your patients with thoracic kyphosis that is flexible and not fixed. And I think one of the things we need to think about is we also, when we're treating somebody with thoracic spine dysfunction, we can't decouple breathing with the thoracic spine, because part of the role of the thoracic cage is to promote chest expansion and to help get air in. A lot of times when patients have thoracic spine restriction, they also have restricted breathing because of musculoskeletal positional positions that they've been in for a long period of time. And so some of these exercises are also good for our patients with musculoskeletal problems. So I know we're teaching this in the context of a cardiopulmonary class, but I don't want you to say, oh, that was cardiopulm, I can't use this with any other patient who doesn't have a diagnosis of COPD or restriction. The other thing, if the patient is having trouble with a long arm getting that trunk around, you can also encourage them to reach over to the side. Can help, or they can also cross their arms across the chest, just to decrease the lever arm that they're having to move.
Absolutely. Remember the clear distinction we made between obstructive and restrictive diseases, right? Obstructive diseases in nature are mostly pathological, but restrictive diseases define anything that restricts the mobility of the rib cage or the mobility of the lung tissue itself. In this case, as she was talking about, thoracic spine. Let's say that she has terrible posture, terrible thoracic kyphosis. This is her normal. Try to breathe in, and that's her normal. We don't see a lot of movement of the upper chest now, right? Maybe a lot of diaphragmatic movement, but nothing up here, so it's not enough. What can we do? Let's dig back into your orthopedic toolbox, and let's pull out some PNF. So essentially what I want you to do is what I'm gonna have her do is similar to the butterfly exercise, but I'm just gonna be concentrating mostly on kind of these chops so that she can expand some of these ribs and improve the mobility of her rib cage. So essentially I'm gonna guide her from here, breathe in and come up, good, and come down, good, come up and come down. And we can switch it to the other side. Something that I like to do too, if the patient has the mobility, because in terms of modifications, if you go back to normal, and let's not clasp your hands. What we're going to do is to kind of do this double PNF side, and it looks just like the butterfly, but we're not really concentrating on the exhalation portion. So we're just gonna come up with both your arms as you breathe in, and as we're expanding this rib cage, good, and back down, good. So she really gave you all a great example of how cardiopulmonary treatments are not specifically and always exclusively for patients that have cardiopulmonary dysfunction, like pathologies. They can have a dysfunction because of lack of mobility of the rib cage or lack of mobility of the spine. Very, very good exercises to do with these patients. You can be seeing a patient that has a knee replacement in your outpatient clinic that has terrible posture and has difficulty breathing. Use some of these. Justify them, and of course do your evaluation first, and you can utilize some of these.